Imagine a hospital on the brink. Cash flow is slowing to a trickle. Denial letters from insurers are piling up, and the finance team is facing a payroll crisis. Every delayed claim means delayed salaries, threatening staffing levels in the ICU. This isn't a medical drama. It's a real-world business thriller happening right now in hospitals everywhere. The culprit: a silent error buried in thousands of pages of clinical notes, draining millions from the hospital's revenue. An error no human could possibly spot in time. But what if an AI could? What if a machine could learn to read patient charts, understand complex billing rules, and stop financial bleeding before it starts? This isn't science fiction. It's the story of how AI quietly rescued a hospital's revenue cycle. In early 2024, a mid-sized community hospital was in trouble. Their medical coders, the people who translate a doctor's notes into billable codes, were overwhelmed. They were battling complex patient records, constantly changing rules, and crippling burnout. The hospital decided to try something radical. They piloted a new AI system, a natural language processing engine that could scan clinical notes and suggest the right codes in real time. At first, it sounded too good to be true. Automate the tedious work, reduce errors, and free up senior coders to handle the truly complex cases. But then, something incredible happened. The AI started building structured problem lists automatically from messy, unstructured doctor's notes. It was like having a super-powered assistant who could instantly organize chaos. Routine conditions and procedures were identified and coded reliably, giving human coders a cleaner, richer starting point. This didn't just speed things up. It helped the hospital more accurately capture how sick its patients really were, which is critical for fair reimbursement. But the real game changer happened on the back end. A second AI layer was deployed to prevent claim denials before they even happened. Instead of just reacting to rejection letters, machine learning models scanned every outgoing claim. They used historical data and payer-specific quirks to flag claims with a high probability of being denied. It was like having a crystal ball for medical billing. Soon, the hospital's denial rates started to drop. One similar rural hospital using this tech cut its prior authorization denials to almost zero and boosted its cash flow by over $2 million. Of course, it wasn't a fairy tale. Early on, the AI struggled with nuances and edge cases. Coders were skeptical, worried about their jobs and the risk of trusting a black box. But the hospital didn't replace its people. Instead, it treated the AI as a fast but fallible junior colleague whose work always needed an expert human eye. The AI would suggest, but a human would always have the final say. This new partnership transformed the entire hospital. Front desk staff made fewer registration errors because the AI flagged them instantly. Doctors saw that their improved notes led to better coding and fewer frustrating follow-up queries. The revenue cycle team evolved from reactive billing clerks into proactive analysts, using AI-powered dashboards to forecast cash flow and guide strategic decisions. Even patients felt the difference. AI-assisted prior authorizations meant fewer treatment delays and fewer surprise bills. It reduced the administrative friction that so often makes a stressful health crisis even worse. By late 2025, the numbers told the story. The backlog of uncoded cases was cut in half. Coder productivity jumped by 40%, and the hospital's revenue lift didn't come from sketchy upcoding, but from getting paid accurately for the work they were already doing. The savings freed up the budget to hire more nurses, directly linking the hospital's financial health to its clinical mission. For an institution that had once considered closing a wing, this was the quiet difference between surviving and thriving. Here's the bold prediction. Within a few years, a hospital trying to manage its revenue without AI will be like a hospital trying to operate without electronic health records today. It will be a massive structural disadvantage. The story of AI in healthcare isn't about machines replacing people. It's about empowering people with incredible tools. It's about turning coders into guardians of both clinical integrity and financial survival, transforming the back office into the strategic nerve center of the modern hospital. Thanks for watching. If you found this look into the future of healthcare fascinating, don't forget to like, subscribe, and hit the bell to stay updated.